Dentists, what is the grossest thing you have ever seen? It was a Tuesday morning, middle of winter, and the office had already fallen behind by an hour. First patient of the day was a walk-in, no appointment, no records. Mid-50s, big guy wearing a torn flannel jacket and track pants with a busted drawstring. He smelled like old cigarettes and damp clothes. He said he'd been dealing with tooth pain for a few weeks, said he couldn't sleep, said he'd been chewing on the other side of his mouth for so long, it felt weird to blink. I brought him back to exam room 3. Told him to have a seat and recline. He moved slow, like everything hurt. When I got him settled, I put on gloves and a mask, switched on the overhead light, and asked him to open up. I've seen bad mouths before. Meth mouths, gum disease, rotting crowns, cracked molars. But this was a different league. His gums weren't pink, they were gray. Not in patches, but all over, like ash. His front teeth were jagged at the edges, as if they'd been broken off with pliers. But the smell, that hit first. It wasn't the usual rot or decay. It was something sour, warm, thick in the air. I've worked in this field for 12 years, but I nearly gagged behind my mask. I leaned in with the mirror, and that's when I saw it. Near his upper left molar, something was moving. Not blood, not pus. I pulled back immediately, switched to the Explorer tool, and gently nudged the area. A small white shape wriggled and disappeared into the gum pocket. Larvae. There were at least 3. He had a fly larval infestation in his gum tissue, oral myiasis. Rare, but not impossible, especially with poor hygiene, open wounds, and exposure to unsanitary conditions. I stepped out to compose myself and grabbed the lead dentist. Told him exactly what I saw. He didn't believe me until he looked for himself. We brought the patient upright and explained what was happening. He didn't seem surprised, just nodded like he'd been expecting something bad. I figured it was bugs, he said. Sometimes it tickles in there. Tickles. He hadn't brushed in weeks, maybe months. Said it hurt too much. He'd been using whiskey as a mouth rinse and chewing aspirin. He'd popped a blister on his gum with a sewing needle. We referred him to the hospital immediately. He needed surgical debridement and antibiotics, possibly IV administered. He had no insurance, but we wrote everything up and called ahead to the ER, explained the situation so they'd admit him under emergency care. He thanked us on the way out, said sorry about the smell, said he just didn't know where else to go. The smell lingered in the room for an hour after he left. We had to open windows and burn through a bottle of medical-grade disinfectant. The assistant who cleaned the tray threw up in the biohazard bin. I looked it up that night, sitting at home with dinner in front of me. Watched a video on myiasis and livestock. Couldn't eat. The next week, he sent a voicemail. Said the hospital cleaned him out, pulled 4 teeth, and gave him a bed for 2 nights. He sounded better, clearer. Said his head felt lighter, like the pressure was gone. I never saw him again after that. Don't know if he got the rest of the treatment he needed. But I'll never forget the sight of those white, squirming bodies in his gums, or the way he said it tickled.